طيب، احنا دلوقتي هنبتدي في الليكشر الثالث اللي هو الايرون deficiency and its implication on children's health, أو part of the epidemic hidden hunger, which is now becoming something very يعني widespread and has a lot of effects فيها مشاكل كبيرة جدا. Let's start our lecture. Iron deficiency and its implication on children's health. زي ما احنا شايفين ان iron deficiency has a lot of implications on children's health. hidden hunger زي ما بنقول او اسمه التاني the cycle of hidden hunger and poverty. الناشونال ايكونوميك ديفلوبمنت بيعمل stalled او diminished economic development, limited capacity to develop. الانديفيدوال لو بقى hungry, malnourished, mothers give birth to low birth weight in the life cycle of malnutrition, diminished physical and mental capacity, compromised health, and poor school and poverty. And more than 2 billion people are affected worldwide. The labor force be reduce work capacity. There is no or lower paid job, lost productivity, lower life expectancy, lower lifetime earnings, اللي بيتسمى في الآخر مثلث الفقر والجهل والمرض. Developing countries are moving from traditional diets based on minimally processed foods to highly processed, energy dense, micronutrient poor foods and drinks, which leads to obesity and diet related chronic disease اللي احنا بنسميه في الاخر empty calories والfast food. Triple burden, a phenomena of malnutrition or undernutrition, micronutrient deficiencies, and obesity. In higher income, more urbanized countries, hidden hunger coexist with overweight and obesity يعني اللي بنسميهم في الآخر منفوخين على الفاضي. Micronutrient deficiencies cause an estimated 1.1 million of the 3.1 million child deaths that occur each year as a result of undernutrition. Vitamin A and zinc deficiency adversely affect child health and survival by weakening the immune system. Lack of zinc impairs growth and can lead to stunting in children. Iodine and iron deficits prevent children from reaching their physical and intellectual potential. حاجات كتير قوي، فيتامين A، زنك، ايودين وايرون، دول المايكرو نيوترينتس اللي يعملوا لنا مشاكل كبيره جدا. Vitamin A deficiency with an estimated of 190 million of preschool children and 19 million pregnant women. We have a low intake of others like calcium, vitamin D, and B vitamins such as folate is also very common. Although pregnant women, children, and adolescents are often cited as populations affected the most by hidden hunger, it impairs the health of people throughout their life cycle في كل الأعمار وفي كل development. Hidden hunger impairs physical growth and learning, limits productivity, leads to poverty. Countries with extensive vitamin and mineral deficiencies cannot realize their economic potential. Poverty is directly related to extent of micronutrients and hence long-term negative effects that constrain socioeconomic development. Iron deficiency. Prevalence of anemia among school-age children. زي ما احنا شايفين البرتقاني الغامق هو السيفير والبرتقاني الفاتح هو المودريت، وقارة أفريقيا كلها في السيفير والمودريت. يمكن احنا عندنا مودريت اللي هو من 20 ل 39%. Disease burden, the most widespread nutritional disorder in the world. It is the only nutrient deficiency significantly prevalent in industrialized countries. Iron deficiency and anemia reduce the work capacity of individuals and entire populations. Population كله يبقى مش مركز، عنده learning difficulties، متنح، Children aged between 6 and 24 months are those most vulnerable to iron deficiency anemia due to their higher requirements of iron for growth. Very critical age من 6 ل 24 شهر اللي هو اللي بنبتدي فيه الويننج اللي بنبتدي فيه introducing solids. Overall, it's the most vulnerable, the poorest, and the least educated who are disproportionately affected by iron deficiency. Again, هنأكد الفقر والجهل والمرض هم دول الريل endemic disease burden that we have علينا على الشعب بتاعنا. Iron deficiency is a state in which the content of iron in the body is less than normal. It occurs in varying degrees of severity. في الأول بيحصل iron depletion، بعد كده iron deficiency without anemia، وبعد كده iron deficiency anemia. Iron depletion is the earliest stage of iron deficiency in which storage iron is decreased or absent, but serum iron concentration, transferrin saturation, and blood hemoglobin levels are normal. Iron deficiency without anemia is somewhat more advanced stage of iron deficiency, characterized by decreased or absent storage of iron, usually low serum iron concentration and transferrin saturation, but without frank anemia. Iron deficiency with anemia is the most advanced stage of iron deficiency. It is characterized by a defect in hemoglobin synthesis, resulting in red blood cells that are abnormally small, microcytic صغيرة لأن الخلية تم الاستعجال في تصنيعها فصغيرة and contain decreased amount of hemoglobin hypochromic. المادة الخام اللي بيتم التصنيع بيها مش موجودة، فبالتالي يتم تصنيع خلايا صغيرة وما فيهاش hemoglobin كفاية. Iron deficiency prevalence in Egypt. The WHO estimates that iron deficiency affects 45.4% of pregnant women and 29.9% of children under 5 in Egypt. يعني نص الستات الحوامل وتلت الأطفال. The problem in infants may be more widespread. A 212 study of 300 infants identified an iron deficient anemia prevalence of 43%. Anemia is a public health problem by country. زي ما احنا شايفين مصر في السيفير اللي هي more than 40 في ال pregnant women وفي ال preschool children في ال moderate. Clinical manifestations of iron deficiency anemia: growth. Iron deficiency impairs growth of infants, and the growth rate is restored when deficiency is corrected. Fatigue. Even late iron deficiency, i.e. iron deficiency without anemia, latent iron deficiency, ده هيبقى iron deficiency without anemia may result in fatigue. Pica. ودي من الحاجات الغريبة اللي في الطب بس بنشوفها بس not that common. Pica is craving to eat unusual substances such as dirt, clay, laundry, starch, salt, cardboard, or hair. It is classic manifestation of iron deficiency and usually is cured promptly by iron therapy within 1 to 14 days. Hair loss. Hair loss may be a consequences of iron deficiency, neuromuscular system, increased muscular anaerobic metabolism resulting in increased blood lactate levels, impaired thermoregulation, behavioral disturbances زي irritability, disruptiveness, short attention span, lack of interest in the surrounding. لو بصينا على السيمتومز هنلاقي ان ناس حوالينا كتير جدا غالبا عندهم iron deficiency. Skin and epithelial tissue. Defective structure or function of epithelial tissues, particularly affecting the nails, tongue, and mouth, hypopharynx, and stomach. Long-standing severe iron deficiency affects the cells that generate the fingernails, producing cholionicesis, which is يعني بيحصل ان في النيلز بيحصل فيها dystrophy. Oral abnormalities including atrophy of the lingual papillae, soreness of the tongue, and by varying degrees redness, angular stomatitis, characterized by ulcerations or fissure at the corners of the mouth, abnormal motility of the esophagus, decreased esophageal contractions, skeletal system, abnormalities of long bones, especially the metacarpal and phalangeal, with expansion of the medulla and thinning of the cortices. The sella turcica may be abnormally small in iron deficient children. Immunity to infection, defective lymphocyte mediated immunity, and impaired bacterial killing and phagocytes. Reduction in the number of circulating T cells. Iron deficiency impairs the immune mechanism of the host. The bactericidal activity of the neutrophils is decreased in iron deficient subject. طب الحل ايه؟ الحل ده احنا we need to give iron supplementation. ال WHO واليونيسيف والاي ان اي سي جي كله بيريكومند ان normal birth weight infants should receive 12.5 milligram iron plus 50 mics folic acid daily from 6 to 12 months. انما low birth weight infant اللي هم born less than 2500 grams should receive 12.5 milligrams of iron و 50 mics of folic acid daily from 2 to 24 months. الامريكان اكاديمي اوف بيدياتريكس بتقول ان breastfed preterm infants should receive 2 milligrams per kilogram a day and from 1 to 12 months as medicinal iron or iron fortified complementary foods. Some formula fed preterm infants may need an additional iron supplementation. Exclusively breastfed term infants should receive 1 milligram per kilogram a day starting when 4 months of age and continue it until appropriate iron containing complementary foods have been introduced وعلى رأسهم اللحوم. Partially breastfed infants should receive 1 milligram per kilogram per day starting at 4 months if more than half of their daily feedings are human milk and they are not receiving iron containing complementary foods. ESPGHAN, which is the European Society for Pediatric Gastroenterology and Nutrition, formula fed infants up to 6 months of age should receive iron fortified infant formula with an iron content of 4 to 8 milligrams per liter, 0.6 to 1.2 milligram per kilogram per day. Marginally low birth weight infants من 2000 ل 2500 جرام should receive iron supplementation of 1 to 2 milligram per kilogram per day. Follow-on formulas should be iron fortified. However, there is not enough evidence to determine the optimal iron concentration on follow-on formula. Follow-on formula هي الفورمولا اللي بتستخدم بعد البري-mature formula. From the age of 6 months, all infants and toddlers should receive iron-rich complementary foods, including meat products and or iron-fortified foods زي iron-fortified cereals. Unmodified cow milk should not be fed as the main milk drink to infants before the age of 12 months, and intake should be limited to less than 500 milliliters per day in toddlers. If I will say حاجة النهاردة مهمة فحتة إن إحنا ما نديش unmodified cow milk. يعني إيه unmodified cow milk؟ لأن أصلا كل الفورمولا is cow milk based بس it is modified. فunmodified cow milk يعني لبن لبن مش modified ده ما يتاخدش بأي حال من أحوال تحت سن سنة، وبعد سنة ماكسيمم يبقى كوبايتين في اليوم اللي هو 500 milliliters. Daily iron supplementation in infants and children. Suggested scheme for daily iron supplementation in infants and children aged 6 to 23 months. عندنا التارجت جروب اللي هم infants and young children 6 to 23 months. Supplement composition 10 to 12.5 milligram elemental iron. A supplementation form drops and syrup. Frequency daily. Duration 3 consecutive months in a year. And settings where the prevalence of anemia in infants and young children is 40% of higher زي الوضع عندنا. على حسب بقى الايرون اللي موجود 10 to 12.5 elemental iron ده is found in 50 to 62.5 of ferrous sulfate heptahydrate أو 30 to 37.5 of ferrous fumarate أو 83.3 ل 104.2 of ferrous gluconate. In the absence of prevalence of data in this group, consider proxies for high-risk anemias for the most recent estimates of the WHO. Dietary recommendation أو dietary recommended intake of iron. Strength of recommendation عندنا في age 0 to 6 0.27 milligram per day. في age 7 to 12 11 milligram per day. 1 to 3 7 milligram per day. 4 to 8 years 10 milligrams per day. 9 to 13 years يفرق الميل من الفيميل ممكن تبقى داخله على سن المنستريشن بس الاثنين واحد 8 ملغ per day. وفي 14 ل 18 male to female is the same 11 ملغ per day. Infant feeding practice in Egypt 28.8% of infants are exclusively breastfed at 4 to 5 months. تلت الأطفال بس هم اللي breastfed. 6.3 of infants complementary feeding at 2 to 3 months of which is very early, and 30% of infants complementary feeding at 4 to 5 which is appropriate, and 12.3 of infants are still exclusively breastfed at 6 to 8 months which is delayed ان احنا introduce solids, و 41% of infants aged 6 to 23 months receive a minimum acceptable diet. يعني نص الأطفال تقريبا بياخدوا a diet that's not acceptable. Infant feeding practices in Egypt, prevalence of exclusive breastfeeding is worse in rural areas, only 10% in a recent study. Another study reported the risk factors of undernutrition, maternal illiteracy, paternal illiteracy, large family size, and lack of exclusive breastfeeding for the first 6 months of life. كل ده is associated independently of other risk factors. Potential reasons for bad practice: socioeconomic challenges, lack of awareness among health care practitioners, ومش أكتر منه lack of awareness, lack of time given للموضوع ده. Customs and beliefs أو misconceptions. Undue influence of family and media. الخالة العمة اللي راجع من الخليج يقول لهم إن هم لازم إيه ده ترضعي ليه، ادي لبن صناعي، أكليه بدري. Lack of guidelines that consider national challenges. Universal screening for anemia is recommended at approximately 12 months of age. Hemoglobin concentration and assessment of risk factors with iron deficiency or iron deficiency anemia. If hemoglobin concentration is less than 11 at 12 months of age, then further evaluation for iron deficiency anemia. Serum ferritin and CRP, a reticulocyte hemoglobin content, mean corpuscular hemoglobin concentration, mean corpuscular volume. The use of transferrin assay as screening for iron deficiency is promising, بس مش كل ده available في السيتنجز اللي احنا فيه. الميجرمنت of iron status عندنا البارامتر SF في الايرون اوفرلود بيبقى عالي، في الديبليتد ايرون ستورز واطي، في الايرون deficiency without anemia واطي، وفي الايرون deficiency anemia بيبقى واطي. الترانسفيرين saturation iron overload increased. في الديبليتد ايرون ستورز نورمال، في الايرون deficiency without anemia decreased، وفي الايرون deficiency anemia decreased. الهيموجلوبين بيبقى نورمال في الايرون اوفرلود، نورمال في الديبليتد ستورز، نورمال في الايرون deficiency without anemia، واونلي بيبتدي يبقى decreased في الايرون deficiency anemia. المين corpuscular volume برضو بيبقى only decreased في ال iron deficiency anemia. Treatment of iron deficiency anemia in children younger than 12 years or for older children and adults. In children younger than 12 years, for mild to moderate iron deficiency, an oral dose of elemental iron of 3 milligram per kilogram per day divided in 1 to 2 doses is usually well tolerated. عيب الايرون ان هو عادة بيعمل constipation. For more severe anemia, 4 to 6 milligram per kilogram per day of elemental iron in 3 divided doses is recommended. For older children and adults, to treat anemia in the older child and adults under medical supervision, the dose is 60 to 180 milligram per day of elemental iron, not to exceed 60 milligram per dose. Oral iron administration can cause gastrointestinal tract symptoms like nausea, vomiting, abdominal pain, and constipation. The incidence of adverse effects is decreased if the iron intake with food at lower doses. Adverse effects of supplemental iron are not well documented in children. Constipation and an increase in infection appear to be clinically insignificant. Solution to hidden hunger. Increasing dietary diversity is one of the most effective ways to sustainably prevent hidden hunger. Fortifying commercial foods by adding trace amounts of micronutrients to staple foods help consumer get the recommended levels of micronutrients. For example, iodized salt, and by adding B vitamins and iron and or zinc to wheat flour and vitamin A to cooking oil and sugar. طبعا الفود fortification ده is a huge science ومهم جدا. The biofortification is relatively new intervention that involves breeding food crop using conventional or transgenic methods to increase their micronutrient content. The biofortification first target rural areas where crops are produced. The biofortified stable food can help close the micronutrient intake gap and increase the daily intake of vitamins and minerals throughout a person's life. Supplementation. Vitamin A supplementation is one of the most cost-effective interventions for improving child survival. In 2012, its estimated coverage rates were nearly 70% globally. Follow the WHO recommendations for vitamin D supplementation. The WHO بتقول 400 international units vitamin D first year of life و 600 international units of vitamin D up to the age of 70. You should all be taking vitamin D. Conclusion: a number of nutritional deficiency remain highly prevalent in infants in Egypt. Infant feeding practices are suboptimal in Egypt despite the presence of international guidelines. There is a need for national infant feeding guidelines to ensure optimal nutrition and improved health وده الحكومة اشتغلت عليه في الفترة اللي فاتت. Increase iron intake, dietary diversification, including iron-rich foods, and enhancement of iron absorption, food fortification, and iron supplementation. Control infection, immunization, and control programs for malaria, hookworm, and schistosomiasis. Improve nutritional status, prevention, and control of other nutritional deficiencies such as vitamin B12, folate, and vitamin A. This is Cairo University, and on the behalf of وحدة التغذية الإكلينيكية مستشفى أبو الريش جامعة القاهرة، ده التيم بتاعنا، بشكركم على حسن الاستماع.